Hi, everybody. It's Dr. Randy Seymour again, and I'm back today with another episode of TMT, or Talking Medical Tourism. And today we're talking hair replacement. The title of today's talk is, yes, bald is beautiful, but having hair is even better. So we're going to be talking with one of the Medi Tours Hungary reference clinics for hair replacement therapy. We're talking with Rita Toth, who is the clinic manager, and Dr. Tess, who is one of the hair specialists. We'll be talking about hair replacement therapy, how does it work, who can have the therapy, how long does the procedure take, and why you would choose Budapest as a destination to come over and have the treatment. So stay tuned, and don't forget to watch the video into the end, where we have a special coupon offer exclusively for our Medi Tours Hungary patients. Be back after this. Okay, so we're back, and I'm back with our two guests, Rita Toth, who is the clinic manager of the hair clinic here in Budapest, and Dr. Tess, who's one of our hair specialists. Hi guys, how are you doing today? Everything okay?
Hi.
Okay.
Yeah, hi, how are you?
Okay, everything is cool. Thanks for joining me today. I appreciate you taking the time to, out of your busy day, to have a little chat with me. So we're talking about hair replacement today. Yeah, it's kind of a common problem from all age groups, primarily men, but we have it obviously in women as well, and it can be quite a frustrating problem. With a lot of guys, it can happen already in late adolescence. You begin to see some thinning of the hair through young adulthood, all the way through middle age. So it can be quite a frustrating problem and a very expensive thing to solve. So yeah, it can be expensive. So the solution we're talking about is hair replacement treatment or therapy. And let's just jump into it. Rita, I'll start with you. If you could just give us a little bit of the background of the clinic here in Budapest, some of the experience. So
Yeah, hi.
Yeah, hi.
Our clinic has been operating for over 25 years now, doing plastic surgeries here in Budapest. And we started with the hair transplant treatments about 6 years ago. So we just searched for the best advanced techniques available on the market. So we ended up at a Manchester and London-based clinic where we brought our protocol from with the FUE2 safe system, which is the most the best technique for hair transplant today, using the original Harris instruments. And now we also have some own instruments manufactured for us in Germany, in addition, for special cases, for example, for beard transplants or eyebrow transplants.
Okay, so you said that the originally you guys brought the methods that you use and everything from the UK, from England. Yeah. So you could say that the standards that you're pretty much applying here in Budapest are pretty much the same as what they do over there and everywhere else in the world and Europe and...
Yeah, it's exactly the same.
Okay, and you've been doing, the clinic is basically operating for 25 years with plastic surgery and for the last 6 years with hair replacement therapy. Okay, can you tell us a little bit about how many treatments do you guys do in a year or in a month? So how
Well, we do two or three surgeries per day. So monthly we can save about 40, 50, 60, it depends.
That's great. So you're a well-experienced clinic. You're doing this like day in and day out. So yeah, okay, that's great.
Transplant doctors are doing only hair transplants. So they are doing this all the week.
Mm-hmm. Cool, great. Okay, I'll turn it over a little bit to you, Tess. And yeah, I mentioned in the beginning of the show here that this is primarily an issue for men, but it can be, hair loss is also an issue for women. Just briefly, could you tell us a little bit about why men lose their hair, why women lose their hair, some kind of background into that? What are the differences?
Sure. Actually, we can all blame it's mostly it's genetics, what we inherited. Both, it can be both in male and female too. The main reason it's hormonal. It's triggered, this type of hair loss is triggered by androgens. That's a male hormone in men, and in women too can be the same reason. But mostly occurring after menopause. The level of the male hormone is increasing, meanwhile the female hormone decreasing. That's the pretty simple explanation of it. But it can be also an infection in the body, which can also lead to type of hair loss that looks pretty in another way than the hormonal hair loss. But then also that can be also a reason behind it.
Mm-hmm. So most of the patients, I guess, that you treat are primarily men. I think, you're having women coming as well, or would you say that most of them are men for that matter? Or does it matter?
Most of them, they are men indeed, but we have female patients too. Uh-huh. Based on statistics and what we see, it works for both. Mm-hmm. But for sure, we have to know the real reason behind this hair loss. Mm-hmm. But if it's a hormonal thing, then it can work pretty well for both.
Okay, so let's talk about the different methods. When I get patients who are inquiring or asking about hair replacement therapy, a lot of them are just kind of saying, well, I don't want to have that huge scar in the back of my head and everything like that. Can you tell us a little bit about today's method and how it differs from that? Do you still use that where you've got to cut out a piece of skin from the back, or do you use different technology today?
No, there is no more full skin cut out, or actually we don't remove anymore a big piece of skin. Actually, we can definitely say that. That was the strip method. Now we use the follicular unit extraction, FUE method, which means we remove all these follicles or hair grafts one by one. So instead of a huge linear scar, we just the patient just remains with some tiny dots, scars, actually we can say that, but which are invisible after the curing.
Okay. And can everybody have this treatment done, or who can have this actually done?
Who has enough hair, mostly, donor area, because as we all know, like we can only use at the moment the patient's own hair to do this transplant. So that means on the back and the sides of the donor area or the head, that hair part, if there is enough hair, then definitely anyone can do who has this part. Mm-hmm. And there are also some kind of disease which might be important to know before the transplant. For example, we cannot do for those who are hemophiliacs. That's an inherited bleeding disease. That's the main important. In any other disease, it might be change the treatment, or it might be stopped for a while. So there are definitely some exceptions. But
so I think, a lot of people might think that you have to be like totally bald in order to have a treatment like that. Is this for people who are just completely have nothing on top? Can people who just have thinning, or how bald do you have to be to have hair replacement treatment?
There are stages. So anyone from stage 1 up to stage 5 who has enough donor area can be done. So it doesn't mean that you have to be totally bald to do the treatment.
And when you say the donor areas, can you show us what areas do we mean by donor region?
This part, actually.
Okay, those are the areas that we obviously
back
don't
of
go
the
bald.
head and the sides up to the ear line.
Okay, so these areas of what have to be thick enough in order to take the hair from here and put them on the top of your head, is what you're saying?
Indeed. Yes, indeed.
Okay. All right, so cool. So let's talk about you know, the treatment itself. I mean, how much can be done? How does the actual treatment look like in the day of the treatment? How much can you do in a day? How much hair can people get?
So what we say at the moment that we can definitely do in a day, it's like, if we talk in grafts, we count in grafts, then it means like 105,000 grafts.
1,500, you mean?
Yes, sorry, yes.
Yeah, 1,500 would be
500.
Okay.
Yes, and if it's hair, then around 3,000, 3,500 hairs.
Okay, so what's the difference between a graft and a hair follicle? I think people get that confused about, and they mix that up. So what's the difference there?
So a graft includes more hairs. So a whole unit includes more hairs, from 1 up to, it can be up to 7 or 8 hairs in a follicle unit or graft. And a graft, it's indeed the whole unit.
Okay, so basically when you pull out a unit of hair, that unit can have either 1 hair sticking out of it,
yes,
it can have
or up to
3,
7.
or even up to 7 hairs. So you really don't know how many hairs you get in the end, but you know that you're going to be getting whatever 1,500 grafts in that day.
Yes.
And that can be actually quite a few thousand hairs actually in one day.
Yes.
Okay.
It's up to, yes, well, we can total do, it's 1,500 grafts.
Mm-hmm. So generally speaking, that would come out to be what, about around 3,000 hairs, or 3,000, more than that?
3,500 hairs.
Mm-hmm.
Yes.
Okay, so that's a decent amount of hair for a day.
Yes, indeed. And it can be repeated, so it can be 2 days, one after each other.
Okay, and how does that day look like? Maybe I could ask Rita. So how does the day, you start out early in the morning, or how does actual treatment day look like?
Mm-hmm. We usually start at 8 or 9 o'clock. Then in the morning we do the harvesting of the grafts. There's a lunch break after that, when the assistants are counting the grafts and hair shafts. And after that, the implantation. In the afternoon, the day ends about 5 p.m. 4, 5, 6 p.m. It depends.
Okay, so this is a whole day treatment. You start off at 8 or 9 o'clock, 8 in the morning, and you're there until 5 o'clock in the afternoon. You get a lunch break in between, and basically you're on the hair bedboard, or whatever you want to call it, all day long. And you guys are working on these guys all day long, on these people all day long. Okay.
Yes.
Back to you, Tess. The treatment itself, I mean, is it painful, or, I mean, does it hurt?
I cannot say it's totally without any pain. I would rather say it's discomfort. It's like being on a dentistry treatment, for example. So it's you won't feel any or real pain. It's mostly just some at the beginning of the anesthetic, the local anesthetic, what you feel, and after it becomes totally comfortable.
So the needle injections.
Yes, indeed, just the needles.
Okay, so once you're over the needle injections, it's pretty much okay.
Yes,
smooth
indeed.
sailing. Mm-hmm. Okay, so the end of the treatment, somebody's done with their treatment and everything like that, then how does the recovery look like? How many days do they need to stay in Budapest? How much care do they need to take care of that hair in the short term, right after the treatment?
So 1 day after the treatment, they can already go back home or return to the normal, to their normal everyday life. We only say it's not prohibited. It's prohibited actually to do any exercise or any activity which involves heavy sweating or lifting weights, for example. And it's definitely important not to sleep under RIA, which where we transferred all these hair grafts.
Mhm.
That's pretty important for like 3 weeks after the surgery. So it means like 3 weeks active rest,
Mhm.
but they can definitely return to work. Or
When can we go back to work out after we have hair transplantation?
3 weeks.
3 weeks. So it's three
After
weeks
3 weeks.
layoff from the gym.
Yes, later on. Yeah, 3 weeks after everything gets back to normal.
Okay. And then when do we get our Elvis fro back? When do we get the hair? How does it come?
Like we say, the pre-final result, it takes 1 year.
Uh-huh.
But that doesn't mean that in 1 year it won't be any change. Yeah, it will. After half year, you can already see a big difference. But we like to say the final result takes 1 year.
Okay. And let's say after 1 year, I look at myself and I go, okay, that's not bad. It looks good, but I'd like to have some more hair. Can I do it again?
If the donor area lets us to take off more units, then definitely it can be repeated.
Okay, so it just depends on these donor areas, how thick these areas here,
definitely.
whether or not you can do it again. I'm assuming that you would just go through the same procedure again, and then after another year, if you want to, you could do it again.
Yes, indeed. We have patients who repeated already like 4 times, 3-4 times. I would rather say in average, it's repeated 2 or 3 times.
2 or 3 times. Okay, so coming out to Budapest, you basically have 1-day treatment. And Rita, how many day treatments can you do in one trip? Let's say someone comes out here. How many do you usually do?
Mm-hmm. 2 days is the maximum. So we don't go over 2 days because we have to be careful with the donor and the implanted areas both.
Okay, so what Tess said before was the 1,500 grafts that could be repeated 2 times. So you're looking at in the neighborhood of maybe even 6,000 plus hairs over 2 days. Correct?
Yeah. Correct. Yeah.
And then you're ready to go home the next day, right after you're done.
Indeed. Yes, indeed.
Okay, so I mean that's quick. It fits into everything that we've been talking about with medical tourism. You could fly over here, have a 2-day treatment, get 6,000 hairs, and fly right back out a day later.
Yes, indeed.
Okay, that's great. Okay, let's finish off my last question here with Budapest. It's very important, the destination that people want to come to. Rita, I'll ask you, why do you think? Why do this in Budapest?
Well, it's one of the most beautiful cities in the world. Of course, that's not the main point here. I can understand. We have very experienced, highly qualified doctors here. For what is not the same as in Western Europe or in the US is the price, of course.
Mm-hmm. So how much cheaper?
With the same quality, but not the same price.
So when you talk about price, since that's really what a lot of people focus on, how much cheaper are we here compared to, let's say, England or Germany or whatever? What would you say people would save?
I would say at least 30, 40, or even 50% off.
Okay, so that's
yeah,
that's quite a lot.
England or German prices.
All right, well that's great. That's pretty significant. And then coming to Budapest is, 1 to 3 hour flight from almost anywhere in Europe. So it's easy to get here. Like you said, it's a beautiful city to come and visit, and it's quick. So you can just get in and get out, and you end up saving a lot of money.
Yeah.
Come over here. So it's a great place. So, okay. I know you've had a famous person over here. William Flood, the Irish footballer who actually came over to your clinic to have hair transplantation. I believe it was last year.
Yeah, exactly.
Right.
But we have had more famous people around here, but of course not many of them wants to announce.
They don't want to announce it.
But Willow was very kind, so he said we can just say and announce that he was here. He had a good time here, and for now he has pretty much hair.
Okay. Actually, I clicked on one of his recent videos, and as he was talking, I said he's already had his treatment here, actually, because I can see that his hair was still we're still growing in those beginning areas. So, okay, so yeah, I think that's I've come to the end of my questions. I hope that everybody enjoyed watching this short little video. I appreciate you guys coming out and taking a few minutes to share with us some of the main points of having hair replacement treatment. And especially, I hope we've convinced you to absolutely come out to Budapest and have the treatment, because it's just a beautiful place to be and it's a lot cheaper. As I promised in the beginning of the video, exclusively for Medi Tours Hungary, we clients who are coming over and booking through our agent company. We have a special €150 voucher off the final cost of your hair treatment. If you do decide to book with us, that's exclusively through us. And I will add some links at the bottom of this video as well. And along with that, there's a couple of gifts that you do get from the clinic, besides obviously your €150 off. When you finish your treatment, you will get this great revitalizing, I don't know if you can see it in the video, shampoo. I'm not an expert on product marketing, but I've read some stuff about this. It's got a whole bunch of great vitamins and plant extracts in it. And it even helps decrease the level of DHT in the body. So for men who have the androgenic alopecia problem, this might help in nourishing your hair and at least making it last, what your original hair last a bit longer. The other thing that all clients get when they come over and they finish the treatment is they get, as you mentioned before, Tess, about not sleeping on the hair and everything like that. As soon as you're done with your treatment, you will get this great neck pillow so that you don't end up sleeping on your head in the first couple of days after the treatment. And then, of course, if you're a little bit more self-conscious, you will also get this great baseball cap as well, so nobody will even know that you've had the treatment at all. So anyway, thanks again. I really appreciate the time. And guys, I hope you've enjoyed this video. If you have, please make sure that you subscribe to our YouTube channel. Press on the little bell to get all the notifications. You can follow us on Facebook, on Twitter, on Instagram. And if you want more information even after that, go to our website, www.meditourshungary.com, and there you can register yourself for a consultation, and we'll be glad to provide you all the information you need on coming over to Budapest and having hair replacement treatment. That's it for me, Dr. Randy Seymour. I hope you've enjoyed the video again, and I will see you soon in the next episode of TMT. Bye for now. Thanks, guys.
Bye, Randy.
Bye. And okay, guys, as one additional note, just to mention that there is a 100% guarantee with the hair replacement treatment that we've spoken about with this Budapest Hair Clinic. Normally speaking, there's about 95% growth rate of the hairs that are transplanted. And if it does turn out that after about a year's time, you don't have that 95%, the clinic will absolutely make the hair replacement for you to get you up to that level for no additional cost. That's it. Bye for now.